So this chapter will cover nervous system physiology. Hopefully you'll be able to tie the muscle physiology together with the nervous system physiology once you understand where the action potential comes from. So action potential or nerve impulse can simply be called a firing, and the study of the mechanism that uh, leads to the production of action potential is called electrophysiology. Okay, so what is an action potential? How is an impulse generated? And how do neurons communicate uh, from neuron to neuron? Or, how do they transfer messages from the nerve to another cell? It's what we'll look at. So, electrophysiology is the study of mechanisms that produce electrical potential or action potentials in cells. Okay, and the electrical potential itself is a difference in concentration of charged particles between one point and the other. So, in case of cells, let's just say this is a cell membrane, the difference in the charges, say, inside and the outside due to the electrolytes gives the cell a charge. Okay, that is called an electrical potential, okay, of a cell. And an electrical current is a flow of charged particles from one point to the other. Okay, and this is due to the movement of ions like sodium and potassium through transmembrane protein channels embedded in the plasma membrane. Okay, so the cells are all polarized. Okay, living cells are polarized, and they have something called as a resting membrane potential. That is the charge of the cell at rest when it is not being stimulated is called a resting membrane potential. For a neuron, the resting membrane potential is minus negative millivolt, and the cells in general have more negative particles on the inside than outside, and they have more positive charges outside the cell. Okay, this creates an electron gradient across the cell membrane, and the difference in charges inside and outside is called the resting membrane potential. Just like you can measure the uh, you know voltage of a battery, let's just say this is a 12-volt battery, you can actually use a voltmeter to measure the potential of a cell. So for neurons, it's negative 70 millivolt. Okay, when you disturb this electrical current and when you disturb these charged particles, which are electrons, in the cell, it leads to a wave of electrical current we call an action potential. An action potential. So moving forward, make sure you understand and remember resting membrane potential and action potential. Oh, so the electricity, let me pick a pointer. Electricity is moving charged particle, right? Let's take a simple example. When you turn the light switch on, electricity runs through the wire to the light bulb, and these particles that are moving through the wire are actually electrons, and electrons are charged particles. Okay, and when we talk of neuron, the wave of electrons through the neuron is called an action potential. So the wave of charged particles through the neuron to create an electrical message, like you see over here, is called an action potential. Okay? And this can only happen when there is a difference in charge across the cell membrane. So nature amazingly has set up excitable cells like neurons and muscles to have more positive charge on the outside. So they'll have a lot of positive charges on the outside and not so many positive charges on the inside. So this difference creates a gradient which makes the electron want to move to an area of lower concentration of electron. Okay, let's just say, for example, we have too many potassium ions inside and you have too little potassium ions outside. When these ions get an opportunity, they will want to move down the concentration gradient. Okay, and this imbalance in charges inside and outside of the cell creates a concentration gradient which generates or helps in generating an action potential. So as you learned in the earlier chapters, cell membrane is selectively permeable. Selectively permeable, meaning it does not just allow molecules to pass through, just like that. Charged particles cannot pass through easily. Large molecules cannot pass through easily. They require assistance of transmembrane channel proteins to move in and out of the cell. Okay, so ions use a lot of different transmembrane channel proteins to move in and out of the cell. One of the most important channel proteins that you have studied in the past is sodium-potassium pump. Okay, sodium-potassium pump, and that pump is shown over here. For every 3 sodium ions pumped out of the cell, this is outside of the cell, so every 3 sodium ions pumped out, the sodium-potassium pump brings in only 2 potassium ions into the cell. As a result, the inside of the cell is less positive and the outside of the cell is more positive. Okay, so the cell not only has sodium and potassium ions, it has other ions that are also sometimes negatively charged, like chloride ions. You have a lot of chloride ions that contribute to the negative charge outside the cell. So you have a lot of chloride ions outside the cell. So what do you think you'll have inside the cell? Yeah, so inside you'll have a lot of proteins that are negatively charged. Okay, so the difference in electrical charges across the plasma membrane is called the resting membrane potential of the cell. In general, for a neuron, the outside is highly concentrated in sodium ions than the inside. Okay, so keep this in the back of your mind. So the cell not only has sodium-potassium pumps. Now the major pumps are sodium-potassium pumps. 40% of the ATP of a cell is used by active transport by a sodium-potassium pump, right? But we have other channels like resting potassium channels that are always open. You have leaky potassium channels. And then you have voltage gated channels that are sensitive to any change in voltage of the cell. Then you have ligand gated channels that open in response to ligand. Ligands are chemical signaling molecules that bind to receptors on the transmembrane protein. Okay. And then you have signal gated channel. Signal gated channels opens or closes in response to specific intracellular molecule. And some other channels like stimulus gated channel. Let me write it down. You have stimulus gated channels in the cell that respond to stimulus. For example, when somebody pinches you, right? You feel the pressure and you feel the pain due to the mechanoreceptors in the skin. These mechanoreceptors receive the stimulus and activate or open, not activate, stimulus-gated sodium channels that allows sodium to rush into the cell. And this is the beginning of generation of an action potential. So potassium is one of the most important electrolytes in the body. Okay, and we just talked about sodium potassium pumps. Let's just assume this is a sodium potassium pump. Okay, sodium potassium pump. The sodium potassium pumps 3 sodium ions out and 2 potassium ions in. Okay, now this causes um, an imbalance in charges inside and outside of the cell because there's a lot more positive charges outside and not enough positive charges inside. Okay. Not only does this contribute to a concentration gradient and an electrical gradient, um, the sodium potassium pump, because it constantly pumps sodium out, the extracellular fluid ends up having a lot of sodium ions, and the intracellular fluid ends up having a lot of potassium ions. Okay, so there are other channels like leaky potassium channels that open up, and these channels randomly open and close, and they can allow potassium ions to move in and out of the cell. Okay, now keep in mind only potassium ions can move because the cell membrane is not permeable to sodium ions, and we don't have enough leaky sodium channels. We have a lot of leaky potassium channels. Okay, and because we have a lot of potassium ions on the inside and not enough potassium ions outside, uh, the potassium ions try to move out of the cell down the concentration gradient. So every time a positively charged potassium ion diffuses out of the cell, the inside of the cell becomes more negative because it loses a positive charge. The cell, however, can never attain equilibrium with regard to potassium on both sides. Why? Because there are proteins inside the cell that are negatively charged, and these negatively charged ions pull the potassium ions inside, and there are a lot of positively charged sodium ions outside. When the potassium ions try to move out, they get repelled by a positively charged potassium and sodium ion, right? So similar charges repel each other and opposite charges attract each other. So the opposing force confuses the potassium, and it's like a tug of war, and eventually the potassium stops moving out and it does not even try. Okay, so at this point the cell is considered to be at rest, and the charge at this point, due to the difference in the electrons across the plasma membrane, is called the resting membrane potential. So for neurons, the resting membrane potential is at minus 70 millimolt. And at resting membrane potential, the cell is called a polarized cell. Polarized because there are a lot more positive charges on the outside than the inside of the cell. Okay? And when you disturb the resting membrane potential, it generates an action potential or an electrical impulse. And these ions, like sodium and potassiums, are called electrolytes. Electrolytes. And electrolytes are very, very important in normal functioning of the body. There's a typo over here. That's off. Remember we talked about the difference of potassium ion concentration across the plasma membrane. There is a lot more potassium inside the cell than outside the cell. Okay, so the concentration of potassium in the extracellular fluid is about 4 to 5 milliequivalent per liter, and in the intracellular fluid the concentration is really high, about 150 milliequivalent per liter. So if you are going into healthcare, you need to remember these values. Okay, anyhow, when the concentration the normal concentration gets disrupted, it can cause a range of health issues. Okay, now the condition wherein we have very low amounts of extracellular potassium ion is called hypokalemia. Hypo means low or below, and kalemia is K plus or potassium. Okay, and what causes hypokalemia? Now there are so many different reasons that can cause hypokalemia, but we are going to focus on a few over here. The first one is inadequate intake of potassium ions. But in reality, no matter how little you eat, you are getting some amount of potassium in your food. Okay, now the people that are in trouble are people who are anorexic and bulimic. Anorexia is a condition where people starve themselves, and bulimia is when people eat, somebody eats and throws it all out, right? Just throws up, forcefully throws up. Okay, this causes loss of fluid and electrolytes from the body. Okay, in your alimentary canal, along with water, even ions move down the concentration gradient. So when you're throwing up, you end up losing a lot of electrolytes. When you have diarrhea, you end up losing a lot of electrolytes. Okay, so the other condition that leads to hypokalemia is excessive use of diuretics. Diuretics make you pee a lot. Okay, so when you pee a lot, you also lose a lot of potassium. Now nowadays you have potassium sparing diuretics that don't lower the potassium levels in the blood when you pee a lot. Okay, and when do you use diuretics? You want to use diuretics when somebody has edema. Edema means fluid buildup. Okay, so when you have edema, say systemic edema, you're probably given diuretics so you can pee a lot and remove a lot of water from the body. Now, the other condition that can cause hypokalemia is hyperaldosteronism. Aldosterone is a hormone that causes the kidney to excrete a lot of potassium. Okay, so as long as your kidney is fine, you're going to excrete all the excess potassium not needed by your body. And hypokalemia can sometimes be seen in kids when they have excessive vomiting and diarrhea in infants. Okay, and when you call the pediatrician, they're going to tell you to give Pedialyte to the baby. Pedialyte is like Gatorade for babies. Okay, if the condition is serious, you'll take them to the hospital and they will administer a sodium chloride, sorry, not sodium, this is a potassium chloride solution. Potassium is never a bolus. Okay, they give it very gradually in very small quantities, but then it is never bolused. Okay, because drastic changes in potassium concentration can lead to sudden death. So what happens in hypokalemia? In hypokalemia, there's an excessive, we don't need this anymore, so in hypokalemia, there's an excessive loss of potassium from the extracellular fluid. Okay, so this leads to diffusion of more potassium ions out of the cell, because keep in mind, potassium always tries to move down the concentration gradients through leaky channels. When there's increased diffusion of potassium out of the cells become more and more negative because they lose a lot of positively charged potassium ions. Okay? And this causes the cell to become hyperpolarized. See, if you lose a lot of potassium ions, you end up having not so much potassium ions inside the cell. This causes increased polarization in the cell. Okay? So when you have hyperpolarization or increased polarization, everything in the body slows down. It causes fatigue, weakness, slow heart rate, very low BP, and when you have really low BP, it causes decreased intracranial pressure, which can cause coma. Okay, so this is a serious condition. Okay, so anytime a person has an imbalance in potassium, they're always hooked up to a heart rate monitor so they can observe the heart rate of the person. So hyperkalemia is the opposite of hypokalemia. Hyper means above. So high concentrations of potassium in the extracellular fluid is called hyperkalemia. And when this happens, potassium tries to diffuse into the cell. Okay, and when too much potassium diffuses into the cell, it makes the cell more negative, less negative, because you'll have almost equal number of positive charges inside and outside due to increased movement of potassium into the cell. Okay, so this movement of the cell from a negative to a positive charge, let's just say 0 or plus 30, this is called depolarization. That means the cell loses polarity. Okay, now too much depolarization makes everything faster and faster. It speeds up the heart rate, it causes fibrillation, it causes increased muscle twitches, and it can lead to death, right? So it can even cause seizures. So hyperkalemia is a serious condition and need to be addressed immediately. Okay, and where do you get your potassium from? Bananas. When you eat a lot of bananas, do you end up having hyperkalemia? No, because your kidney does a good job of excreting excessive potassium and other salts and waste products from the body. Okay, now when can you have hyperkalemia? You can have hyperkalemia when you have kidney failure, and when you have a kidney failure, you don't efficiently remove potassium, and this can cause increased concentrations of potassium in the bloodstream. And the other condition that causes hyperkalemia is, well, hypoaldosteronism. Hypoaldosteronism causes your kidney to retain too much potassium. Okay, now this treatment is hard. First of all, diuretics can help in loss of potassium, but they take a lot of time. So you can use diuretics in patient, or you can use ion exchange resins, or you can use hemodialysis. Hemodialysis is done for patients who have kidney failure, and every other day they spend 3 hours in the dialysis center to purify blood, right? Ion exchange resins, on the other hand, bind to potassium in the stomach. So they suck potassium out of the bloodstream into the alimentary canal. they form a complex salt and then you poop it all out. Okay, so that's simple enough. So this is how you can treat hyperkalemia.